From the Baker Institute for Public Policy at Rice University in Houston, Texas, this is Baker Briefing. I'm Ambassador David Satterfield. Baker Briefing tackles the most critical foreign and domestic policy issues of the day. Through conversations with subject matter experts, we seek to provide meaningful analyses and independent perspective. Each episode is recorded in front of a live audience at Rice University in Houston. Today's topic: America's growing public health epidemic, gun violence. To lead today's discussion, I'm pleased to welcome Dr. Rola El-Serag, a medical practitioner and researcher who heads our Center for Health and Biosciences. She's joined by Dr. Sandra McKay, a pediatrician and the Baker Institute's Huffington Fellow in Child Health Policy, and Dr. Bindi Naik Matharia, a pediatric trauma surgeon and the Baker Institute's Fellow, Firearm Injury Prevention and Safety.
Thank you, Ambassador Satterfield. Earlier this month, in Newport News, Virginia, a first-grade student at Rich Neck Elementary School, just 6 years old, brought a gun to school in his backpack and shot his teacher. The gun had been legally purchased by his mother. Fortunately, the teacher survived, but the community is forever changed, traumatized even, by the events of that day. How do we as a society even begin to process something like this? The incident at Newport News is shocking, even for a nation that has witnessed almost daily mass shooting events. In 2021, there were 692 mass shootings, 42 of which were school-related. In 2022, there were 648 mass shooting events. Even more disturbing is the upward trend in gun violence affecting children and young people under the age of 21. In 2020, gun violence became the leading cause of death in children, surpassing motor vehicle injury. These are sobering statistics and the subject of today's conversation. Dr. McKay, Dr. Naik, thank you for being with me today. To start, a question for the both of you. Is it accurate to say that gun violence is now a public health epidemic?
I would say that gun violence is a public health crisis. It is greater than the cost of obesity in America. It is greater than the cost of Medicaid. It is costing more than $500 billion annually, and the impact to the healthcare system is insurmountable, and it is a pace that we cannot continue. Not only just the cost of lives lost, but the lives of those that have been injured and impacted by gun violence, and additionally to the impact to the communities, to those that have faced the ripple effect of those injuries, to those children, those families, those loved ones that have been faced with those injuries.
Yes, I agree. Being the leading cause of death for not just children and adolescents, but youth, more than cancer, more than infection, more than motor vehicle crashes, it absolutely is an emergency public health crisis in our country. What's even more shocking is what an outlier our country is compared to other developed countries. So the rates of all those other infections and cancers and other health conditions may be similar in other developed countries, but this is far more, 27 to 30 times higher in our country, which makes it a uniquely American problem and a crisis that we need to address emergently.
To follow that up, as noted earlier, gun violence is now the leading cause of death among children. So, Dr. McKay, are children the only demographic group significantly impacted by gun violence? What else does the data tell us about the big picture trends?
While it is the leading cause of death in children, children are not the only demographic impacted by gun violence. Gun violence impacts all ages, all races, and all areas and regions across the United States. It is an urban problem, it is a rural problem, it is an everywhere problem. 70% of the suicides in the U.S. occur with firearms in ages 65 and older. So it does impact the older generation. It disproportionately impacts by race. When we look at people of color, the Black population make up about 12.5% of the total US population, but it also makes up 61% of all gun homicides. Black women are twice as likely than white women to be fatally shot by an intimate partner. We have significant disparities across our demographics when it comes to firearm injury, and we need to look at where we can improve some of these injuries that are happening.
Thank you. Dr. Naik, how has the uptick in gun violence nationally affected the medical community? Broadly speaking, are physicians trained to respond to the demands of an America plagued by gun violence?
So in the trauma center, the major trauma centers, the answer is yes, although the trauma centers are very strapped with the increased amount of gun violence that they're seeing. Outside of a few major cities, most trauma used to be from blunt mechanisms, such as car accidents. Penetrating trauma is very different. It requires a much faster response. It requires complex surgical capabilities. It requires massive amounts of blood. And not all trauma centers, I would say very few trauma centers actually, besides the level 1 and level 2s, which are few around the country, are equipped for that. So when you look at the vast portions of the country that don't have one of those trauma centers, they are not equipped to handle these. And I think that there's a lot more deaths, a lot more potentially preventable deaths in rural areas. Additional to that, there's a lot of increased trauma and stress for the medical community. You know, seeing these things on a day in, day out basis is very difficult. And I think that the medical community often feels angered and helpless that we can't do more about this when it's a potentially preventable problem.
I think this would be a nice time for you to share with us what led you to go into this sort of research and work, policy work.
Absolutely, sure. As a resident at Ben Taub Hospital, which is a very, very busy trauma center here, I used to see people shot by guns 4 or 5 times a night, and that was traumatizing in itself. But then when I went into pediatric surgery and I started seeing children coming in, innocent children, 2 years old, 3 years old, some of whom were just caught in the line of fire or had unintentionally found a gun at home and shot themselves or their sibling, that really got to me. A lot of people talk about the deaths from gun violence. I think what's even worse is the ones that don't die. And there was one particular child who had a very severe injury just sitting at home, and it came through the door. And I took care of him and watched him in intense amounts of pain and go through many operations and everything for 7-8 months, and still lives with chronic disability. So that one case really inspired me to do something about it.
Fantastic. Dr. McKay, would you like to share with us as well what has led you to go into this area of policy?
Well, prior to becoming to Texas, I was involved in Missouri, and part of my leadership roles was working with the American Academy of Pediatrics. And in Missouri, they were attempting to pass legislation to ban physicians from asking about firearms within the clinical encounter. So I was able to work very closely with a lot of the legislators there to try to explain to them what we do in the clinical encounter. And I'm like, for me, it's no different than asking, you know, do you use a car seat? How do you lay your baby down at the bed? And trying to talk to legislators, say it's not about asking why you own a firearm. I want to help you store that firearm safely and make sure that you're using all the same safety precautions that you would if you were trying to install a car seat properly in your child's car. And fortunately, we were able to do a lot of advocacy efforts and educate the legislators in that our discussions with patients is purely focused on safety. But it also highlighted for me the importance of really engaging physicians in policy and using the research and the evidence to help inform evidence-based policy, because it's really vital to have policy that is informed by research, because without that, you really can't drive the policies that are important in order to support saving lives.
Let's discuss the issue of prevention. So the role of the family physician is potentially a very important one in firearm injury prevention, as you were just mentioning. As a pediatrician, how do you go about assessing risk and providing safety counseling to families and children, and how can these efforts be replicated nationally?
Well, the single most modifiable risk factor for firearm injury prevention is access, right? And so part of the role of the pediatrician is to counsel and to ask about how firearms are stored within the home. And so what we train physicians and pediatricians to do is to have that counseling and that asking, but unfortunately a lot of pediatricians don't ask because they're not trained on how to do this. So we have to educate physicians and other providers on how to ask about firearms in a culturally sensitive manner within the clinical encounter. And then we have to provide appropriate counseling on how to do safe storage, which is storing the firearm unloaded, locked, and the ammunition locked separately. And then also doing what we can to help promote knowledge about the developmental stages of those who are in the home. And I think about developmental stages across the spectrum. You know, we've got the baby who's in the home, and that's when the parents are a little more receptive to change. And you've got your toddler who's getting into everything, and your impulsive adolescent. But let's not forget about the adult who may, be experiencing something like dementia. Are they really responsible in that dementia stages for being able to manage their firearm as well? So those are things that we really want to work on, promoting those things. And even from a national level, how can we promote the implementation of universal screening for firearms within the clinical encounters across all spectrums, both inpatient and outpatient?
And Dr. Naik, I also know there's an effort on addressing preventative issues in the trauma center. Could you comment on that and kind of let us know the role of prevention in the trauma center?
Sure. Yeah, so I think it's important to understand that gun violence is a multifaceted problem, that the shootings that you hear about that are interpersonal assault, street violence, that are often related to poverty, that are related to drugs and alcohol, possible gang use, desperate situations, things like that, are very different from the child who finds a gun at home loaded and shoots themselves, are very different from suicides, are very different from someone who's just standing in a street corner and is caught in a line of fire. And so one of the things that we're trying to focus on is prevention, but the prevention is different for all of those different things. It's not as simple as saying wear a bike helmet. It's much broader than that, and sadly it's much more complicated than that. There's not a simple fix. And so trying to identify risk factors, safe storage is a huge one, mental health screening is a huge one, and then also try to identify vulnerable populations for the interpersonal violence. For example, parts of the city, there might be more age groups, certain risk factors that are both personal and neighborhood and social based. And through all of those things, hopefully we can prevent them, but also we can identify people that come into the trauma centers or even in hospitals in general and provide some support systems for them in the community.
So I think that the trauma center is an excellent place, but people who tend to present there with gun-related injuries have a high likelihood of re-presenting them.
Yes.
So it's an opportunity to,
yes, exactly,
to catch and intervene and modify risk factors. Dr. Naik, how has the broader medical community delved into the policy debate surrounding firearm safety?
I definitely think that there's been more involvement recently as the uptick has increased and it's become more of a public health crisis. Physicians are regarded by most people, maybe after the COVID crisis a little bit less, but are regarded as trusted messengers by most people. And I think that using our voices wisely to not just talk to our patients and families, but also to talk to legislators, just share our stories and our thoughts is very powerful. And physicians are becoming more engaged in that, although we could be doing a lot more on a national level.
Would you say that overall there's consensus among medical practitioners and researchers on what policies are most effective and should be prioritized in this area?
Yeah, I think there's definitely consensus that it's a problem and that something needs to be done about it. I think that there's probably a lot of consensus regarding certain policies such as reducing access to assault-type rifles. But there's a lot of doctors who are gun owners as well, and maybe on the other side of the debate. So it's a little bit polarized regarding all access, but things like safe storage, things like reducing access to assault weapons, things like background checks, raising the age to buy certain types of weapons. I think those types of policies, absolutely, there is a consensus, yes.
Dr. McKay, regarding firearm safety and injury prevention, often following a mass shooting event, there are inevitable calls for change. And as we know too well, unfortunately, the gun control debate remains a political war zone. Dr. McKay, how important is the language and framing when it comes to advancing firearm injury prevention goals?
Well, it's super important to know that whenever we discuss policy, it often falls into this rhetoric of you're coming to take my rights away, you're coming to take my guns away. And it's important to know that policies are meant to help remind the firearm owner that we are here to help preserve your firearm rights by instituting policies that can be effective in reducing gun violence. Because truly the greatest threat to gun rights is gun violence. And if we can work to reduce gun violence, we can help protect the rights of the lawful firearm owner. And utilizing language and clear language is really important. And because that's really where a lot of the debates and the sparks can really fly. For example, the use of unclear language like the assault rifle or the assault weapon. The assault weapon is a really ambiguous term because everyone interprets it differently, and that can be very polarizing and very negative for both sides because everyone interprets it a different way. So we have to be really clear in our language, clear in how we do it, and also use respectful terms for both sides. So that way we can reach that ultimate shared goal, which is reducing gun violence. Because at the end of the day, even when you talk to firearm retailers, they don't want to be the ones that are selling firearms to the Uvalde shooter. And they have that shared goal of, having less gun violence on the streets. It's just about how do we get to that ultimate mechanism.
And because we're sitting here in Houston, Texas, a state which has seen the highest number of school shootings in the past 10 years, and we have some of the least restrictive gun control laws, what would you say are some practical firearm safety measures that Texas state lawmakers should adopt to advance public health?
So some of the things that we can do initially are advancing things like background checks. Background checks are universally supported across all of Americans. 90% of Americans, including firearm owners, support the use of universal background checks. We are a state that has child access prevention laws. However, our child access prevention laws only are for when a child has already accessed a firearm. We are one of 34 states with child access prevention laws. However, if we were to adjust our child access prevention law to have it to where if a child could have accessed the firearm, that would be a little bit of a stronger prevention law. That would be another one. Another law that could be implemented in Texas that would be palatable would be mandatory safety training for new firearm owners. That would be something that we already have a structure in place for. Hunting licensees require a safety training for youth, especially when you look at the most recent shootings from 2018. For the deadliest mass shootings, those were committed by people who were under the age of 21. So that would be an implementation that you could do to say youth should undergo safety training for their first firearm, especially in a younger demographic. You could target that population and say you require safety training. Additionally, waiting periods have been implemented in other states that are similar to Texas as well. Florida has a 3-day waiting period. Waiting periods as short as 24 hours have been demonstrated to reduce intimate partner violence and also to reduce suicides as well. So even as short as 24-hour waiting period could be helpful in reducing injury.
Again, all of these suggestions are focused on prevention and not taking away gun owners' rights.
Absolutely. You can still get your firearm, own your firearm. We're not implementing anything that is reducing someone's right to own that firearm.
Dr. Naik, can you point to some effective firearm injury prevention policies in other states that have proven to be effective?
Sure. There are about 19 states, I think, that have extreme risk protection orders, or sometimes called red flag laws, whereby if somebody thinks that someone they know or are in contact with may be at risk to themselves or to someone else, then they can be reported essentially and their firearm would be held. So those are in place. There's some evidence that shows that they can be helpful, particularly to prevent firearm-related suicides. Maybe not so much for homicides or mass shootings yet, but I think that the evidence is still out there. There are some states that have very strong background checks, and that's definitely helpful. There are a handful of states, I think very few, maybe only 4, that still have ban on assault-type rifles, and those states have less mass shootings. There's some evidence that shows that strong child access protection laws where parents are held liable for children who can access loaded weapons does decrease child shootings, unintentional child shootings, and deaths. So those are the ones that I'm aware of that work.
Good. It sounds like we have some very good data-driven examples from other states that we can learn from in the state of Texas and hopefully can be used to drive policy here. Thank you very much, Dr. McKay and Dr. Naik. Can I get a final word from each of you? What is the most critical policy change that you hope to see in the coming year?
As someone who operates on people with firearm injuries, assault-type weapon rifles are the ones that I would like to see less of. They're very, very different from the handguns that are the vast majority of shootings. We can save people that are shot from those most of the time, unless they're shot right in the heart or something. We can often save them. But the ones that are from assault-type weapons cause massive tissue loss. It can shoot off a whole extremity or, leave a huge cavity. And no matter how quickly you get to the trauma center, no matter how much blood you give them, no matter everything else, we can't save them. And so in my mind, there just doesn't seem to be a place in civilian society for people to have those weapons on the street, in their homes or anywhere. Maybe they could just have them at shooting ranges and they can shoot them there, but they shouldn't be available to the general public. That's my personal opinion.
It's good to hear that perspective. I don't think a lot of people think about the perspective of the surgeon and dealing with the aftermath of these sorts of injuries. Dr. McKay?
Certainly, I think one of the things that we can look at is when we're looking from a state level, I think something feasible would be implementing universal training requirement for training, safety training for all new firearm owners. I think is something that would be a feasible and reasonable policy solution for the state of Texas. And I think that's something that could be implementable because there is a structure and a foundation within the state of Texas. I think nationally a policy priority should be mandating and increasing the amount of funding for firearm injury prevention research, because that has been horribly underfunded for decades. And we do not prioritize it as a research priority within a national level. And It has not been adequately given the priority that other disease processes of similar caliber. We spend hundreds of millions of dollars researching obesity and cancer, and we lose more lives to gun violence, and we have a greater cost to our healthcare community to gun violence, and yet we barely study it. We barely invest anything to our communities and to our country, and we owe it to our citizens and to our nation to develop and invest within there to do some of these expansions and to really prove where we can save lives.
Thank you very much for your time today. This has been very informative.
Thank you for the opportunity.
Baker Briefing is brought to you by the team at Rice University's Baker Institute for Public Policy. This episode was produced by Victoria Jupp, Shannon Moriarty, and Ben Stevenson. AV production was provided by Kevin Young. Logistics support was provided by Jean Ard, Star Dickerson, Rachel Smith, and Macy Stewart. Many thanks to the Baker Institute interns who assisted with this episode: Maya Adkihari, Sarah Davidson, and George Ruthven. The Baker Institute for Public Policy provides meaningful policy analysis on the most critical challenges facing Texas, the U.S., and the world. It is a nonprofit, nonpartisan policy research organization based at Rice University in Houston, Texas. To learn more, including how you can attend a live podcast recording on the campus of Rice, visit us at bakerinstitute.org. Thank you for listening.